Everybody, it's Dr. Pearlman. I'm back with another video. And today I am going to keep this video about back pain. So if you out there are suffering with back pain and cannot seem to get over it, especially back pain that is keeping you from doing things that you actually love to do, like running, exercising, playing with your kids, getting up, sitting down for a longer period of time to standing up, and your back is really giving you issues, this video is for you. And the way I'm going to start this is I have seen a lot of TikTok and YouTube and Instagram and whatever social media videos recently that are saying, fix your back pain today. These two or these three exercises, whatever, are the exercises keeping you from having a healthy back. A lot of them are derivatives or really just copying knees over toes guy who is, I think Ben Patrick, if I'm not mistaken, who is, phenomenal with his content and his exercise and his rehab. And the thing people really need to realize when they're making these videos is they're actually making them for active, healthy people that, say, on a pain scale might have a 2 out of 10 of back pain, really tight back pain. Maybe they've had a debilitating injury long ago, which has since been remedied, and now they're thinking of ways to bulletproof their back or to really strengthen and become mobile without doing physical therapy, without doing chiropractic, without having surgery, which, by the way, as a caveat, or should I say as a disclaimer, like, do not have surgery until surgery is the absolute only thing that is left to do to potentially heal your back, which would likely be due to stenosis, which means narrowing of the spine in certain areas. Stenosis has just a big spectrum of stenosis as itself, within its own right, And if you listen to my content, you'll know that health is on a spectrum. Functionality is on a spectrum. Disease is on a spectrum. How hurt your back is from 1 to 10, that's a spectrum, from lowest to highest and everything else in the middle. So what's wrong with these videos when they're trying to show you how to bulletproof your back? Well, they're not taking into consideration the diminished ability to recover as we age. There's a reason why your 50-year-old dad or your 60-year-old dad or your 78-year-old grandpa has a much harder time getting around. And it's not just because they're old. It's because as they've aged and they've lost the resiliency of the tissues to repair the way you at a 25 to 35-year-old level can, they have lost that ability and nobody showed them the way, meaning they never had the opportunity to take advantage of a lot of the progressive medical, I don't want to say medical, because it really is more of a like nuanced, niche, anti-aging, if you will, kind of approach, like this functional medicine approach, this kind of alternative is the word I was going for, the alternative approach to healing and how that pertains to your back. And here's number one. This is the number one thing I'm going to say. In my experience, being somebody who's really suffered with a lot of back pain and in my opinion has had sort of I don't want to call it a failed surgery, but an experience where surgery really didn't fix the underlying cause. Like, that's crazy, right? Why didn't surgery fix the underlying cause? And some people out there might think, Pearlman, you're psychosomatic and it's all placebo and all. No. We're not even going to go down that road. So this is what we're going to do. We're going to talk about why people don't get fixed and then have a really hard time progressing. And here's number one. People who have never had a real trauma to their back, meaning they didn't have a slip and fall where they landed on their butt that kept them in 10 out of 10 pain. They never got thrown from a motorcycle. They never had a football injury where it was head to head, where they actually had a compression or even worse, maybe a burst fracture. Again, on a spectrum, burst fracture, not just to the neck, we're talking life and death. I'm talking about an actual compression fracture, but due to the compression may have had a bit of a burst. And maybe the bone didn't shatter, and maybe that's a misnomer to some of you out there, but that could be the way that things like Schmorl's nodes begin to develop. That could be the way that things like hemangiomas may start to develop within bone, and then you're actually having things called bony edema or bony swelling, and this is real stuff you can see clearly on MRI and certain CTs. And these are diagnostic, I don't want to call them diagnostic, you can say they're indicators of someone that's had a really traumatic kind of spinal injury versus people that may just have disc herniations or disc bulges that they don't really know how it got there. And that's where the ideals of sort of evidence-based views of back pain come into play where they're like, I could show you the worst back on an MRI and have no pain, and I could show you a 2 millimeter bulge at L4, L5, who knows how it got there, and they're 10 out of 10 pain. And then people will say, well, pain is subjective. No, I'm actually telling you that in my clinical experience, it's people that have had a trauma associated to the back, physical altercation, car accident, everything we just talked about before, you just pick, that those are the ones that seem to suffer the most. Why? Because the trauma or the injury, like the mechanism of injury that created it never feels like it got something to remove it. That's why chiropractic is actually so effective, because chiropractic can fight the sort of trauma or the force with a force or trauma. See, an adjustment isn't actually anti-inflammatory. Just like just like exercise isn't anti-inflammatory. The compounding interest and the tissue resiliency of exercise makes you more resilient toward the inflammatory component. Just like an adjustment, if done well, and actually makes that joint sort of reset, right? The crunchy cavitation, the satisfying sound and feeling, triggers the brain to let you kind of let it go and reset the joint so it has the ability to heal. That healing in itself with enough rest can then begin to repair properly and then go through more range of motion. Now, I didn't do that just to promote chiropractic. What I did was I took you down that road to show you how tissue resiliency in older age, when it comes to a trauma that began to reduce the amount of activity that somebody could do to make them feel that injured, has a pathway of developing resiliency and beginning to heal with a physical, intervention, with a modality like chiropractic or even acupuncture. That's a whole other, realm of healing and blood flow. But that's sort of the window of what they need. Now let's go into phase 2. Whether they had that or not, how can then somebody a little bit older who may just have regular back pain and not the debilitated person that I'm referring to in the beginning, even though I'm really speaking to you. You are the people that are still listening to this video because you have significant pain or have had significant pain and are trying to find ways to manage it and are trying to find ways to sort of, get your life back. Like for me, I would do anything to be able to run 5-6 miles in the morning again. Hell, I'll give anything to run 2.5 to 3 miles in the morning every morning again and have an easy recovery. And that comes down to my newest, sort of latest fascination, which is peptides. Honestly, I think the compound safe sort of chain of amino acids known as peptides that can be utilized through clinical determination, if you're even a good candidate for it, can work wonders in terms of reducing not just systemic inflammation, but can actually do things like signaling growth hormone in a safe way without being on full-blown anabolic steroid type HGH and potentially having side effects. You can do like a compound in pharmacy, doctor recommended, doctor oversight, dosing responsibly, and not just reduce the inflammation, but actually signal muscle growth, reducing hunger, and thereby not getting the big like insulin surges that would keep us inflamed, but would actually be able to target maintaining lean muscle. Now, what happens to older, frail people? Well, they lose muscle. They don't go to the gym and they're not able to move because of that tissue resiliency. Again, they can't move like they wanted to. They lose that energy, they lose that drive, they lose that metabolism. Things like peptides, and that's why they call it longevity, are actually giving back the ability to have this, energy, to have this drive, and then they'll be able to recover better by them, lifting more heavy weight. And they don't have to become a bodybuilder, but when I say lifting heavy weight, it's preserving lean mass that is going to be therefore healthier metabolically into older age. And it's also going to keep you moving, continuing with that tissue resiliency, developing into an older age. So you don't ever have to get to that point where you're really moving slow and, confusing people to, God forbid, if you had some kind of Parkinson's disease. And I'm not saying that, throwing that in there like, well, now he's talking about Parkinson's. I'm saying if you're moving really slow and your back is really bad, sometimes people will confuse that you have some kind of a neurologic disorder because of that shuffle gait, because of how slow you're moving. And so I just gave two examples over a 10-minute video of, the most disabled via usually to trauma. And it hasn't been addressed because you haven't found the right chiropractor. Maybe something like acupuncture was going to be something that will help you. Maybe something physical. Maybe surgery was the option. Maybe some kind of a special injection is out there that you just haven't found the right doctor to then really say, oh my God, like I feel good. I can move again. Like I've had a couple of good weeks. I've been struggling with my back, my story. I'm not going to bore you with it, but in a couple of good weeks, a lot of the newer things I'm beginning to implement have begun to give me a little bit more freedom to have a longer walk, to begin to do a little bit more calisthenics. And the thing is, every time I do a little longer walk, every time I do more calisthenics, just like you all out there, you're actually building the resilience. You're beginning to utilize inflammation properly, building up something known as hormesis for the body to adapt. And that's the goal for everybody, whether you want to know it or not. So if you want to know more about this, feel free to reach out. If you have any questions, I try my best to get back to everyone in the comments, especially when it's kosher. And until next time, everybody, it's Dr. Pearlman.